Hello, I'm Tony DeMaria, the editor of JACC, here with some of the highlights from the May 22nd issue of JACC. And the first paper is from Ed Hannon in the New York State Registry that's attracted a lot of attention for looking at the quality for percutaneous intervention in CABG. Dr. Hannon and his associates used the recently published appropriateness guidelines from the American College of Cardiology to look at the New York database to judge the appropriateness of revascularization in that state. And they examined some 42,000 acute coronary syndrome patients, so ACS patients from the New York database. Now what they found was in 90% of the patients undergoing CABG, the procedure was felt to be appropriate. In 14% of patients undergoing percutaneous intervention, the procedure was felt to be inappropriate. Now this is in the context of the fact that 50% of the patients undergoing PCI were felt to be uncertain in regard to the appropriateness or inappropriateness. And nevertheless, clearly 14% of patients inappropriate was a bit of a surprise, a little bit high. Most of these patients had single or double vessel disease, not on maximal medical therapy, not showing high-risk evidence of ischemia. So we don't have any evidence from this database as to underuse of revascularization, but I think a subset of patients undergoing PCI was identified where we may need to keep a closer eye. The second study deals with some 3,000 patients followed in an HIV clinic and asked the question about the prevalence of sudden cardiac death in these patients. Now what we know is that as the mortality rate in HIV patients has gone down from the infection itself with the very effective retroviral therapy, that the incidence of coronary artery disease has gone up. And in fact, what they found was that a 13% incidence of sudden death in these HIV patients, which in fact was a 4.5-fold increase over the control group. Now, most of these patients did have cardiac disease, but nevertheless, an important issue to identify those patients with HIV who are at risk of sudden death when their infection itself is doing reasonably well. The last paper to discuss deals with the issue of secondhand smoke, particularly aged secondhand smoke, since what's known is as smoke lays around a given area, it becomes more toxic. And Peter Ganz and associates at UC San Francisco studied a group of normal individuals who were exposed to progressively higher levels of aged secondhand smoke. And what they observed was a proportionate increase in the reduction in endothelial dysfunction. So there was no evidence of a threshold. Even the lowest levels of aged secondhand smoke reduced endothelial dysfunction. So a warning for all of us to, both for ourselves and our patients, stay out of areas where there's a lot of secondhand smoke. For Inside JACC, I'm Tony DeMaria.